2-year-old boy was found with his mother at Mass and Cass. That area in Boston has been plagued by drug use and homelessness. But as we reported this week, the discovery of a toddler, this raises new concerns about safety. And here to talk about this, share her thoughts, is Dr. Alice Connors-Kellgren, a clinical psychologist at Tufts Medical Center. Great to see you as always, Doctor.
Hey, Dr. Alice, thanks for your time. So as you know, this is a complicated problem. We're not going to solve it in our 2 or 3 minutes here. But adding a kid to this chaos seems to make it even worse. That's just my impression. What's your reaction?
Well, you're absolutely right. This is an incredibly complex problem, and we could talk for hours and barely scratch the surface of all the factors. That being said, my first reaction is just immense concern for this child being exposed to both physical risk factors and dangers, but also psychological risk factors. The kind of substance abuse that we see at Mass and Cass can lead to violence, really bizarre behaviors, overdoses, and death. A child that age witnessing these things or, becoming victim to these things is incredibly traumatic, especially for a kid this age who really doesn't understand what's going on.
So, Doctor, we know, unfortunately, there are a number of families in the United States who are living in difficult situations. They live in cars, they live at campgrounds, some even live on the street. So what can you tell us about the long-term impacts, never mind on the adults and the families, but on kids specifically?
Yeah, kids are tremendously impacted by not having safe or secure shelter. So a lot of times what this means is that they don't have reliable access to medical or dental care or food or education. They tend to have higher rates of missing school, which means that they have delays in their academic achievement, and they don't have access to a consistent peer group, which is really important for their development. They also have They also have higher rates of victimization, such as being abused, being involved in community violence, and being bullied. So this can lead to a range of mental health effects, including higher rates of suicidality, substance abuse, depression, anxiety, basically you name it.
And when you were going through the rundown there, and when Maria was talking about it, stability popped in my head. Why is stability important for a child?
Yeah, so stability is one of those things we kind of take for granted as adults, but for kids, it's really vital, especially for very young kids, like between the ages of 0 and 5. Kids have very little control over their environments, and so they really depend on routines and predictability in order to feel safe. And then that feeling of safety is the foundation for many of the skills that we as adults rely on to manage our emotions, complete tasks, and function in relationships. So when kids are homeless and they don't have stability or predictability, it can be really hard to develop these skills.
Dr. Connors-Kellgren, thank you so much for your time. We appreciate it.
Great
Stay
to see
well.
you, Doctor.